Why do I have tingling, numbness, burning pain, sharp pain in my feet? This is a question I hear a lot in my clinic. More often than not, the cause is diabetic peripheral neuropathy, or DPN. Unfortunately, DPN can also be seen in prediabetes, so it's pretty common. Neuropathy is another word for nerve damage, and in this case, chronically high blood sugar levels damage the long sensory nerves that carry sensation all the way from your feet to your spinal cord. Hi, I'm Dr. Maria Conley. We're going to talk about diabetic peripheral neuropathy, which is seen in approximately 9 to 14% of US adults. If you consider that about 50% of diabetics will get peripheral neuropathy, and that about 10 to 25% of pre-diabetics will get it, the total estimated number of people affected in the US would be approximately 23 to 35 million adults. It's a lot. So, what is the natural progression of diabetic peripheral neuropathy, or DPN? Early in the disease, small unmyelinated nerve fibers such as A delta and C fibers are affected. When damaged, these fibers cause burning pain, tingling, numbness, and increased temperature sensitivity. The abnormal sensations will often start on the bottom of both feet and involve the toes. DPN is typically described as occurring in a stocking and glove distribution, as the nerve damage starts in the feet and then moves up the legs as the disease progresses. Once the nerve damage reaches the knees, it can start affecting both hands as well. Nerve damage always occurs in this type of pattern because the long sensory nerves that span the distance from your spinal cord to your feet are uniquely vulnerable to damage. The cell body of the nerve is in the well-protected dorsal root ganglion near your spine. However, nerve signals must travel down an axon that can be up to 20,000 times longer than the cell body of the nerve. That's like wrapping a power line around the Earth's equator one time. This would be the length of a sensory axon traveling from your spine down to your feet. And the further away the nerve is from blood supply, the more likely it is to get damaged. As your nerves are exposed to high blood sugar levels for longer periods of time, the damage worsens. As the disease progresses, larger myelinated nerve fibers such as A alpha and A beta fibers are affected, causing loss of position sense or proprioception, muscle weakness, and loss of reflexes. DPN can be very damaging at this point. If your feet are numb, you're not going to be aware of a foot injury, and you're at much higher risk for developing an infection in that wound. High blood sugar also damages the capillaries that supply blood and oxygen, so a wound will not heal as quickly. The nerve damage in DPN is due to a condition of sugar or glucose overload in the body over many years. Excess glucose that your cells cannot use as fuel is processed in harmful ways that can create toxic byproducts such as reactive oxygen species, or ROS. You can think of ROS like sparks from a fire that end up in the wrong places and cause damage. Your body is usually able to neutralize these dangerous molecules, but in unhealthy conditions like chronic sugar overload, your body runs out of these antioxidants, causing ROS and other toxic byproducts to pile up in the body. This condition, called oxidative stress, is the final common pathway of nerve damage in diabetic peripheral neuropathy, or DPN. Once the sensory nerves are damaged, they're like frayed electrical wires, which can become hyperexcitable and send pain signals to your brain even in the absence of any stimuli. This is due to excessive spontaneous nerve firing. Nerves depend on the flow of ions such as sodium, potassium, and calcium to transmit signals. The concentrations of these ions is tightly regulated by the ion channels, which can become damaged, leading to hyperexcitable nerves that are constantly transmitting pain signals to your brain. DPN is the most common complication of type 2 diabetes. It's best just to avoid getting it altogether, as unfortunately there's no cure once you have it. If you do have neuropathy in its early stages, it's important to recognize it so you can stop its progression by maintaining a healthy weight and keeping your blood sugar well controlled. Thank you for listening. I hope this is helpful for you.